growth, regeneration. It's what keeps us going, living, reproducing. Our bodies have the amazing ability to heal injuries, mend broken bones, repair skin damaged from sunburn or stomach lining after an ulcer. That's because we're made of trillions of cells that know precisely how to grow, repair and replicate themselves, and slough off when they're supposed to. But have you ever thought about what would happen if they let that power get out of hand? Well, it does happen, and it's called cancer.
Cancer cells lose control. They're like teenagers that are not behaving. They're running out of the house, and sometimes parents can control them and the body's able to control them, and other times they totally go out of control and they start multiplying in uncontrolled ways, and they also start growing in places they're not supposed to go.
That might not sound so bad. We're made of trillions of cells. What are a few extra, right? Well, cancer cells don't behave properly, and their very existence can destroy the function of whichever organ they're inhabiting, like weeds choking out a garden. And when that garden is, let's say, your lungs, the result is no bed of roses. Unfortunately, the lungs are a popular destination for uncontrolled cell growth, and lung cancer accounts for 15% of all cancer diagnoses. It's not hard to figure out why the lungs are so vulnerable.
The lungs are subject to the entire environment as opposed to many other tissues that are sheltered from the environment. So the lungs are exposed to the air. They're exposed to any kind of toxins in the air, any kind of dust, fumes, and in most societies, I won't even say the United States, but most societies, cigarette smoking is quite common. And we know that cigarette smoking and the multiple toxins in cigarette smoke are the leading identifiable cause of lung cancer.
Common symptoms are difficulty breathing, chest pain, a persistent cough, and recurrent lung problems like pneumonia or bronchitis. But if you're a smoker, or if you know one, you've probably realized that a lot of smokers already have these symptoms. So it's sometimes hard to spot the difference between the hazards of being a smoker and lung cancer.
That's one of the tragedies of lung cancer, is it's very difficult to suspect that you have lung cancer. And if you're a cigarette smoker and your cough suddenly increases, or you have a cold that doesn't seem to go away, or you start coughing up blood, these are signs of lung cancer.
With cancer, there are two rules. 1, do what you can to prevent it by avoiding environmental exposures and keeping a healthy diet and lifestyle. And 2, catch it early. Now, we're taking care of the second rule by screening high-risk patients, like anyone who has a history of a previous tumor, or chronic lung disease, or tobacco abuse, and improving imaging techniques and medical treatments. But you've got to help us with the first rule. After all, preventing cancer in the first place, always a much better idea. So be a good body parent and keep your cells from misbehaving. I'm Dr. Keller Wortham, and you're watching the eHealth Network. We'll be back in a bit.